Today we're going to talk about compression fractures. So let's say you or your loved one, a parent, let's say, has been diagnosed with a compression fracture. What exactly is that? What happens is over time, we undergo a process called osteoporosis, which is thinning of the bones. And this affects the bones throughout the spine and the entire body. And what can happen is the density of the bone thins so much that you're actually prone to a fracture. And let's say you have a person in their, typically 70s or 80s that slips and falls and has sudden onset of severe back pain and is diagnosed with a compression fracture. What they've actually done is they have actually fractured their spine. They've actually cracked the outer portion of it, and now it's moving around. And the reason that it's so painful is because there are a lot of pain fibers on what's called the periosteum, and that's a little fibrous covering around the bone itself. So I don't know if you've ever had a fractured bone, but you know it's extremely painful. And it's really painful because of that periosteum, and that's where the pain fibers are. So these folks will have severe back pain, they'll have difficulty getting around, and unfortunately oftentimes they're seen in the ER and told that it's going to heal over time. And then they go back to their primary care doctor and are told that there's nothing to do about it. Unfortunately, that's not the case, but that's still a common misconception out there. Now, in a subset of the population, you can put these people in a brace, give them some anti-inflammatories and some low-dose pain medications, and they can still get around and go about their daily lives. But in a significant amount of people, they have severe pain, the pain medications don't work, and they start losing a lot of function. And sort of by definition, if you have severe bone thinning or osteoporosis to the point that a fall breaks your spine, you probably have some other issues and you probably don't have a lot of reserve. And these people can undergo a number of complications. The first one is the pain medications. Oftentimes they're not really effective and they can affect the patient's balance. So let's say you're 80 and you've got bad thinning bones, you have a compression fracture, and you're taking an opiate medication. I've seen many patients who actually have subsequent falls as a result of the medication. The other issue they have is that they can't take a deep breath because it's painful, and they're prone to pneumonias and other complication. And then the other issue is they just don't want to get out of bed. They don't want to get around. And these individuals typically don't have a lot of muscular reserve, and they can atrophy significantly and can lose a significant amount of function in a relatively short amount of time. So there's no real recommendation of when you need to treat these or how quickly. I have a colleague who is an expert down at UC San Diego, and they typically do about 2 to 3 weeks of conservative therapy, which is bracing, medications, and want to see a significant turnaround. They want to see them doing much better. If they're not, then University of San Diego will move towards what's called a kyphoplasty procedure, which is where it will actually stabilize that fracture for the patient. So the main purpose of today's video is that compression fractures are painful, they're a real problem, and if you or your loved one has one of these, you shouldn't wait much more than 3 weeks before you get it treated, because they can suffer significant side effects such as subsequent falls, complications related to the pain medications, loss of function, and potentially worse, such as pneumonia and other things, and it can lead to pretty bad outcomes. And by far the worst outcome I see is where the fracture starts to compress over time, and then what can happen is it can compress so much that the back of the vertebral body breaks out and presses into the spinal cord. Once that happens, there's really not much we can do for the patient. They're not a candidate for surgery. It's a pretty devastating complication. So these are things to think about. If you knew your loved one has one of these and you're not getting better and it's been 3 to 4 weeks, then it's time to take some action and get this patient treated. And we'll go over specifically how to treat these things and what the process is in subsequent videos. I hope this was helpful and look forward to talking to you again.